The human body is a marvel of biological engineering, designed with a remarkable level of inherent resilience and structural integrity. This complex design allows us to navigate various physical challenges throughout our lives. Central to this survival strategy is the concept of reserve capacity, which enables our systems to maintain functionality. Many of our organs possess a significant reserve capacity, allowing them to function effectively even when partially damaged. For instance, a healthy individual can live a full life with just one lung or a single kidney. Remarkably, the liver can lose more than 2/3 of its mass before serious consequences arise. However, this resilience is not universal across all systems. Vital organs like the brain and the heart are far more sensitive to damage. Even minor disruptions to critical areas within these organs can lead to devastating outcomes, as they lack the extensive reserve capacity found in the liver or kidneys. If an artery in the brain becomes blocked or ruptures, a stroke occurs. Even a small amount of tissue destruction in a vital part of the brain can be catastrophic. Depending on the location, a person may suddenly lose the ability to speak, move a limb, or maintain their balance. The heart is equally vulnerable to localized damage. If a heart attack destroys a small amount of tissue in the specific area that creates or carries electrical signals, the results are severe. The heart rate may become dangerously slow, or the heart may stop beating entirely, leading to potential death. The relationship between anatomy and disease is a two-way street, where changes in physical structure often lead directly to illness. When the blood supply to a specific tissue is blocked or cut off, that tissue dies in a process known as infarction, manifesting as heart attacks or cerebral strokes. Structural issues can cause an entire organ to malfunction, such as when an abnormal heart valve disrupts blood flow. Even the skin, our primary protective barrier, can lead to systemic illness if it is traumatized. Damage to the skin allows infections to bypass our first line of physical defense. Abnormal growths, such as cancer, present a different kind of structural threat. These growths can directly destroy healthy tissue as they expand. Furthermore, they can create destructive physical pressure on surrounding organs and vessels, ultimately leading to the failure of otherwise healthy systems within the human body. To understand and treat these conditions, medical science has developed sophisticated ways to look inside the body non-invasively. This journey began with the breakthrough of X-rays. For the first time, doctors could examine internal structures and diagnose issues without the need for risky and painful invasive surgery. A major advance in medical imaging was computed tomography, or CT, which revolutionized how we see inside the body. By combining traditional X-rays with advanced computer processing, a CT scan produces detailed, two-dimensional cross-sectional images of the body's interior, allowing for a much more thorough examination of internal structures. Modern medicine utilizes a variety of other non-invasive technologies to visualize anatomy. Ultrasound is a common tool that uses high-frequency sound waves to create images. It is particularly valued for its safety and ability to provide real-time images of moving organs and developing fetuses without using radiation. Magnetic resonance imaging, or MRI, offers another highly detailed view of the body's interior. This technology works by tracking the movement of atoms within powerful magnetic fields. MRI is especially useful for imaging soft tissues, such as the brain, spinal cord, and muscles, with incredible clarity and precision. Radionuclide imaging is a specialized technique that employs injected radioactive chemicals. These chemicals travel to specific organs, allowing doctors to track how those organs are functioning. This method provides unique insights into the metabolic activity of tissues, helping to identify diseases that might not be visible through other methods. These advancements represent a shift from invasive procedures to clear, data-driven insights. By using sound waves, magnets, and computers, we can now identify structural abnormalities and disease processes early. This non-invasive approach significantly reduces the risks to the patient while providing doctors with the information needed for treatment. These technological advancements allow modern doctors to diagnose and treat diseases with a level of precision and safety that was once unimaginable. By moving the focus from invasive surgical procedures to clear, data-driven insights, medical science continues to improve our understanding of the complex relationship between anatomy and disease.